Today I'm going to be talking to you about taking medicine sublingually. This is done by putting a cannabis extract, usually a tincture, under your tongue or rubbing it on your gums and letting it absorb there for a few minutes. Taking your medicine this way allows the extract to go straight into your bloodstream without passing through your stomach or your digestive tract. Now this is useful because it offers high bioavailability. It has a longer effect than inhalation and is a really clean way to take medicine. This intake method has a wide range of uses and it's a wonderful way to start your relationship with cannabis. It's predictable and has an even-keeled onset, and this can be really useful for a more subtle effect. For instance, when taken for general lifestyle enhancement. Here are some key things to keep in mind with sublingual intake. Products used sublingually come in the form of tinctures, infusions, or concentrates. This method allows for extremely accurate doses. Tinctures are often measured by the drop and concentrates by weight. And if you're using a concentrate, we recommend that you use a high-quality digital scale as well, because this will really help you with your accuracy. It's really important to use clean, safe medicine and be aware that not all cannabis extracts are created equally. The concentration levels and the extract processes can vary quite a bit. And as always, we recommend lab tested is best, as you can easily see what you're getting. Now the onset time with sublingual intake is generally between 10 and 30 minutes. And depending on your goals, we suggest starting with a minimal dose. And if more is wanted or needed, you can easily increase in a really short period of time. Now, if taking a THC-dominant cannabis oil, there is likely to be some psychoactivity. You may like to go back and revisit the Introduction to Cannabis Intake Methods video, in which we shared some typical effects of psychoactivity. Tinctures are typically dissolved in either olive oil, coconut oil, or alcohol. We like the oil versions because cannabis interacts really well with fats, and they also tend to be a little bit more pleasant to take as well in terms of taste. Today we have some examples of tinctures, infused oils and concentrates to show you, and we're going to demonstrate how to measure your dose and take each of them sublingually.
So let's get acquainted with products that can be used for sublingual use. Now remember, sublingual use is when you put a product under your tongue or on your gums and inner cheeks so that it can be absorbed into your body. Now today I'm going to show you concentrates as well as liquids or tinctures that can be used for sublingual use. Before I get into those specifically, I want to make a point. Really, with sublingual use and with any of these products, you know the form of the product, whether it's a concentrate that hasn't been diluted into any other substance, or a tincture, for example, that has been diluted into something like alcohol, olive oil, or coconut oil. But remember, no matter the form of the product, you don't necessarily know by looking at it how concentrated it is. You can dose it, but without knowing the concentration of cannabis within that specific product, you won't know exactly how many milligrams you're taking. So that's a little bit of what we're going to get into today. Now, concentrates, obviously from their name, are one of the most potent, purest form of cannabis. Usually, this is a pure form of cannabis that has been extracted from the plant, either from bud, from shake, or any other forms of the plant itself. Now, given that how highly concentrated the medicine is, you really want to be careful with it and be able to measure it accurately. One way to do that is through the syringe, where it has actual measurements. But the other tool you want to use is a digital scale, so that you know exactly how concentrated the medicine is inside, as well as the exact weight that you're getting when you actually put it in your body. And those two combinations of pieces of information will really tell you what dose you're taking. And that way you can track what dose, measure its effects, and then dose effectively going forward. Now, a great way to do this for concentrates is to use a piece of rice paper. Now, rice paper because it's edible and it dissolves in your mouth. And that way you can actually get the concentrate on the scale, put it onto the rice paper, weigh it, know what you're taking, and then simply put it into your mouth, under your tongue, and let it dissolve there. That way it's not messy. Rice paper is also great if you want to just measure your medicine once, maybe put it in the fridge or the freezer, and then take it later. You can have those doses for yourself ready for at a later date so that you don't have to create as much of a mess. These products can be a little bit hard to deal with, and they're a little bit molassesy, as you can see from the color of this. All right? So concentrate's very effective. Usually they're used for much more severe conditions when you're trying to get a much higher dose of medicine into your body. Let's move on to liquids, or sometimes called tinctures. Now, these can be infused into a number of liquids, as I mentioned, either usually alcohol or oils, which can be usually coconut oil or olive oil. What happens with this process is the medicine is extracted through various methods. There's CO2, there's butane, there's other alcohol extracts, and then that concentrate is then infused back into an oil, or they leave a little bit of the alcohol and put it back into alcohol. That way, diluting the medicine a little bit to be able to be taken in liquid form. When taking, it's pretty intuitive. It's nice because you can dose the medicine very effectively with the dropper. Now, ideally, your dropper has some type of measuring mechanism on it, so you know exactly the milliliters that you're taking and can dose that. Again, you really want to know how concentrated this medicine is. It could have, for example, 1/4 oil in a lot of medicine. That's a very concentrated tincture. It could have, 95% oil and 5% medicine. Those are very different products, very different medicines, depending on the dose, okay? So pay attention to that. Know from your labels and from your medicine providers how concentrated that medicine is. Now, when taking medicine, simply put it under your tongue, as mentioned, let it absorb there, and that's how you can take a sublingual tincture. All in all, sublingual medicine is a great way to take medicine, get it into your body effectively with high bioavailability. Remember the points that we touched on. It's really important to know how concentrated your medicine is, and it's important to measure it effectively to be able to track